Tonight, in the Alfred Hospital's intensive care unit.
After his transplant, he was fine on his feet, doing everything, and now all of a sudden he's back in hospital.
The day he came in, I thought he was probably going to die that night.
The nerve to the voice box was spread over the tumour.
It was growing that rapidly that it would just block her airways and she'd die. Simple as that.
Open your eyes up as wide as you can for me, Tim. This
is the direct result from alcohol-fuelled violence. Should never, ever have happened.
The sickest patients, the most advanced technology, medical care second to none. It's always a matter of life or death.
Hi, Layla. Do you want that tube out?
In the general pod of the ICU, Layla has had a tumour the size of a tennis ball removed from her neck.
It was a large benign tumour that was pushing into her throat and pushing into her airway, growing in size on the side of her face almost week by week. Here we've got a scan that's like a slice through the face. That's the jawbone at the front. The black is the airway of her throat, and this is the big lump. On this scan, it shows the external carotid artery, which just goes into the middle of the tumour and feeds it.
Layla's tumour was all tangled up with her carotid artery and the nerves of her voice box.
We were able to take the lump out without excessive blood loss and preserving really what we thought was realistic in terms of her nerves and in terms of her vessels.
Layla first noticed the lump in her neck 2.5 years ago.
In the last 6 months, it's doubled in size. It was growing that rapidly that it would just block her airways and everything and she'd die. Simple as that. Finally, operation yesterday, which they said we're going to take 6 to 8 hours, and it took 12 hours. 12 hours of just sitting at home, just waiting, and every hour I just kept ringing. And at 6 o'clock, I thought I just couldn't wait at home anymore, so I came to the hospital.
The ordeal is not over yet. If the surgery damaged Layla's voice box, she may be free of the tumour, but unable to speak. Last time in the Alfred Hospital's intensive care unit, we met Tim, who had a severe brain injury after being king hit at a party.
At the party, someone asked him to ask a group of people to move on, and he did. That's the sort of kid he is. He finished up on the concrete, obviously with one hell of a blow.
Tim was in a deep coma with a severely bruised and swollen brain. His doctors removed a small part of his skull and inserted a drain to relieve the pressure.
My worry would be over the next couple of days that these pressures are going to get worse as the brain starts to swell around bruising where the injury's been. So I would say he's in a critical condition at the moment.
Tim's family has been waiting 2 weeks for him to wake up.
I want you to open your eyes up as wide
His
as you can.
First tiny response was cause for celebration.
As wide as you can, buddy. Oh, you bleed. That's it. Well done. I know, it's a big relief, isn't it?
But now, just as Tim begins to show signs of recovery, he's facing a new threat.
He's got a temperature. His white cells are up, which means they're all signs of infection. It's quite serious. He could recover from this head injury, and it could be the chest infection and following sepsis. That could be his detriment. Tim
is a very sick boy, and this chest infection could be the last straw. In a nearby cubicle, Joe is in a critical condition. He came into the Alfred for a routine hemorrhoidectomy, but while he was in recovery, he suddenly, mysteriously, had lung failure.
I'm just waiting on the results to actually...
Yeah, it's just that things like RSV have got specific treatments, adeno's got a specific treatment, none of which I'm using at the moment.
This is Joe's second visit to the ICU this year.
Joe had a lung transplant 4 months ago. He underwent a double lung transplant. He had a lung condition called sarcoidosis that he'd had for 10 years or more, but it caused progressive destruction of his lungs. For the first 3 or 4 months, we had no real great concerns, and he then underwent a relatively minor surgical procedure not connected to his lungs just over a week ago, and 48 hours after that developed progressive respiratory failure and requiring him to be put on a ventilator down here in the intensive care unit. OK, I'll come back later when we've got some of these results. Okay. Otherwise, it would be no change. Continue with what we're on.
Joe's sudden decline is a terrible shock for his family.
After his transplant, he was fine on his feet, doing everything, and now all of a sudden he's back in hospital, not able to move.
All patients following a transplant go on these potent drugs called immunosuppressives, which means that they are prone to infections, and going into the winter flu season, we wonder now whether or not he's picked up some virus in the community and that this is what has caused his respiratory failure.
We just don't know what's happening. And hopefully we do get some answers soon and they'll be able to treat whatever it is.
The ICU team has tried every therapy they can think of, but they're fighting an enemy they don't even recognise.
There's nothing more we can really do at this stage until we either come to some conclusion as to what's causing this condition or the decision is made at some point to stop treatment.
That's it. Nice big deep breaths.
In the Alfred Hospital's ICU, it's 24 hours since Layla had a massive tumour removed from her neck, and she's just had her breathing tube taken out.
You all right? The operation went really well yesterday. One of the nerves, the nerve to the voice box, was spread over the tumour, and we had to remove that. So you may have some trouble with your voice and with your swallowing. Can you count to 5 for me? 1, 2, 3. There was always a strong likelihood that she would have voice problems after her surgery. We were hopeful that we might be able to remove the tumour without removing a section of the nerve, but it was always a strong risk, and, you know, we warned Layla about the voice and the swallowing. You know, it's something that I think, you know, we're going to need to manage. Her treatment hasn't finished in that regard. Just get yourself better for a start, and then we'll work on the voice and the swallow.
In the meantime, Layla's tumour has been sent to pathology.
That we paint the surface blue to indicate where the surgery has been, and we'll then take cross-sections through it so we can have a look and see what's it like down the microscope.
Katrina's looking for malignant cells that would indicate if Layla has cancer elsewhere in her body.
By tomorrow afternoon, the results will be finalised.
Then Layla will know if the horrible tumour has gone for good. It's been 2 weeks since Tim came to the trauma pod with a severe head injury.
His respiratory rate's quite fast, isn't it? Something with his gases.
And for the past 4 days, Tim's been battling a secondary illness.
He has had a little bit of a chest infection with some chest X-ray changes and some bugs in his sputum, but his X-ray looked better today, and I think his cough is now strong enough that we can be confident that he'll be able to keep his chest clear of the phlegm that he's got to deal with at the moment.
Tim's able to have his breathing tube taken out, and with his sedation lifted, his family is hoping he might finally be able to speak.
Hi, Timbo. Hi, Tim. Tim, it's Mum, Jess. Been through a bit, have you, mate? Tim?
Timbo?
Yeah. Yes. There, you squeeze it, darling. You squeeze it very hard, mate.
That little dog of yours at home, he misses you so much.
Leave him on just for a little while, all right?
You got...
Pardon? Leave it on, darling. Bloody hell. That was bloody hell, I think.
You're allowed to say that, that's all right. We didn't really know what we were gonna get, so for him to growl at me straight away. Pretty good.
So don't, Jess.
It's a start, but Tim has a long road ahead.
It's very frustrating watching patients like Tim come through. The perception is that, you know, the patient's still alive and the injury hasn't killed them, but the neurological damage is often quite severe. They're potentially not the same people.
In other words, Tim may never fully recover from the devastating punch to his head. In the general pod, it's day 12 for Joe, who's desperately ill. He's on heavy doses of antibiotics and steroids, and just keeping him stable is a juggling act.
He's had clots go to his lungs, so his blood needs to be thinned out to try to dissolve the clots that are already there and prevent further clots from occurring. He's also had problems with bleeding, so we can't thin his blood out as much as we would like to, because as soon as we do, he starts bleeding. If he were not in the intensive care on the amount of support he's on, he would have died by now.
After 6 days with Joe close to death, the ICU team's hard work pays off.
I'm quite happy with his progress. Although we haven't found out exactly what was wrong, he's clearly responding to the various treatments he's had, and at the moment he's the best he's been since he's been in the intensive care unit.
Yeah, the sedation. We're going to win. We've got rid of one of the sedation, so it's comfortable because he said he hasn't got any pain.
But Joe's improvement is very brief. A short time later, he becomes dangerously unstable and has to be rushed to theatre.
So we'll go to the lift, guys, and be quicker.
In the trauma pod of the Alfred Hospital's ICU, Tim's brain is gradually returning to a normal size, and his doctors have decided it's safe to take out the drain put in to relieve the pressure.
Now that he's awake and extubated and he can follow commands, we can just follow him clinically. So by just performing simple neurological exams, we know that the pressures in his head are generally okay.
Leaving the tube in could lead to a life-threatening infection, like meningitis.
So I'm just pulling the tube out now. This part tends to not be too uncomfortable. Okay, so fluid's coming out now, which is the spinal fluid. So we actually need to close this to stop the leak of fluid from coming out. Okay.
With the drain out, Tim's able to leave the ICU for the first time in more than 2 weeks.
Balloons up, mate. A little bit of sunshine on your face. Turn you around, eh?
When someone wakes up, they're very disorientated, very confused, and the best thing we can do is not only reorientate them towards family and friends, but also reorientate them to like a day-night routine. So the reason for taking him outside was to show him the sunshine and the fresh air and the birds and the trees and the seasons, and that gives him a sense of reality and exposure to, I suppose, kind of reintroduce him back to the world again.
Although Tim's now wide awake, only time will tell if Nola's good-natured son will ever re-emerge.
The back bit's what you're going to have to worry about.
A week has passed since Layla had the terrible tumour taken off her neck, and every day brings good news.
How you going?
Good.
Now, you know the pathology showed that it was the benign vascular tumour that we talked about. No sign of any spread to the rest of your body, and I don't think that it will spread now, and that it's all out, so that's good. The other thing I might do is take all these dressings off, see how your wound's going. Look, I'm very happy with the way her surgery's gone and with her progress, and you know, I think she's likely to have some voice and some swallowing difficulties in the long term, but I think these will be pretty minor. And I think she'll get back to a normal life. That looks great. We'll give it 1 more week, and then I'd like you to get just massaging the area with some vitamin E cream. You've got your jawbone back at least. You're going well.
Thank you.
Slowly and carefully. We'll get there. We'll see you later.
3 weeks after her surgery, Layla and John are back at the Alfred for a checkup.
It's all good, and I'm very thankful with the doctor and all the staff. Yeah, they've done a good job. It's made me feel more confident now than before. Made me feel happy.
with a sparkle.
In the ICU, Joe is back from theatre after emergency surgery to repair a rupture in his bowel.
So what have you got running there? Sedation?
We've got Actrapid, we've got Propofol at 200.
We need morphine.
This latest setback is unrelated to Joe's lung problems.
No anticoagulation.
It turns out Joe has diverticulitis, which caused his bowel to rupture and spill the contents into his abdominal cavity.
Luckily, we were able to find it in time, and the surgeons have fixed where the leak in the bowel was, and he's on very powerful antibiotics to try to prevent any infection from progressing further.
It's now 3 weeks since Joe came to the ICU, but he's nowhere near well enough to leave.
I know he has to be here to progress in his recovery, but it is really hard. It's been very hard for all of us. I think he's not coping very well at the moment. He's just struggling with, staying in the one position. I just want to bring him home, and the kids want him home. And, if we could, we'd just take him home now, but we can't.
Joe's progress is slow. He seems to be taking 1 step forward and 2 back. It's now day 18, and Tim's ready to leave the intensive care unit. But first, as part of an Alfred education program, Tim's dad Daryl has been asked to talk to a group of high school kids.
This is the direct result from alcohol-fueled violence, which has totally wrecked our lives, Tim's life, his girlfriend's life, his sister's life, and all his friends. So next time you're at a party or whatever and there's a bit of a blue or whatever, just turn around and walk away. You might think you'll give some young bloke a clip in the ear, but you might connect him a bit hard next time, and this could happen to him. If we can help one person from not coming in here and going through what we've gone through in the last 2.5 weeks, well, we've at least done something.
Tim's finally off to the ward.
See you, Tim.
Thank you. People in ICU are the greatest bunch of people I've ever met in my life. We've got a lot to thank them for. Doctors and nurses, they've been really good to us. Nice and relaxed this morning, Tim.
Are you comfortable?
Getting out of the ICU is a step in the right direction, but Tim's brain injury will be with him forever.
Tim's doing okay. He's still getting tired. He's enjoying the company of us, the family members. He gets a little bit agitated, but yeah, Tim's doing okay.
He's got head injury down the more severe end of the scale, and his responses now are slow and cautious and fluctuant.
And every time you get out of bed, what have you got to put on?
Helmet.
The helmet, good boy.
The fact that Tim is slow now doesn't matter as much as how he's going to be in 3, 6, 9 and 12 months. That's obviously the key things for him. And how much work we can put into his rehabilitation and stimulating him mentally in that time is going to help very much in assisting his best possible recovery.
It's more than a month since Joe came to the Alfred, and today is a good news day.
I mean this in the nicest possible way, but I'm hoping we get rid of you today. Yeah, he's done really well. He's been very determined. He's eating and drinking. He's driving himself on. He's got to the stage now where he's not needing any extra support that can't be provided for him in a normal respiratory ward. So I'll actually be doing the ward rounds in the hospital, so I'll come and visit you. Okay, I'll see you later.
Joe has made a great recovery, but he's still very weak from his illness. It's going to take time to rebuild his strength.
It's an uphill battle. It's all uphill, but we'll get there. We did it the first time after transplant. We'll do it again. It just takes determination, and I've got plenty of it.
Three weeks on, and Tim is leaving rehab and heading home to Colac in country Victoria.
6 weeks? Where's 6 weeks gone? How one little thing can upset a whole family.
We've been very, very lucky. You know, there wasn't much hope there, and we've come a long way in such a short time, and he's really done well.
Tim's going to need to wear the helmet until a piece of skull can be put back in place. His immediate goal is pretty simple.
Just go back to my hometown, see what's going on down there. Yeah, so I can't wait.
Two months have passed. It's been a long journey for Joe and Sonia, but today they're full of hope.
Today's the day that Joe goes to rehab, which is really exciting. So we're just packing up, getting ready for the ambulance to come and take him there. One step closer to home.
I'm going to live for the today and not for tomorrow. Because after what I've been through, we don't know when tomorrow comes. So live every day as it's going to be your last.
Next time, in the Alfred's ICU.
He'd apparently been trying to free some cattle from the fires.
He's got 50% burns to his legs. Usually he's a strong one. Yeah, I've got to be strong now.
I saw the car, which gave me a terrible fright. It was totally crushed.
The doctors have just said that I've got some bleeding around my lungs.
The heart's not doing anything.
At the moment, he's on a significant amount of life support. His heart attack is very bad.
I'm sure deep down he knows he can fight this.